Good afternoon and welcome to News Around Africa with me, Esther Wilson. A Sudanese court has sentenced Rapid Support Forces (RSF) leader Mohamed Hamdan Dagalo, also known as Hemedti, to death after convicting him of war crimes, crimes against humanity, and genocide over atrocities committed in West Darfur. The court, sitting in the army-controlled city of Port Sudan, also sentenced 15 other senior figures of the RSF as a paramilitary group locked in war with the Sudanese army since 2023 to death over the same crimes. The Sudan Founding Alliance, a political coalition that includes the RSF, reportedly rejected the ruling while Hemedti was tried in absence and his whereabouts are not publicly known. The RSF itself has not directly commented on the verdict but has repeatedly denied accusations that it has committed war crimes. The judgment was issued during a humanitarian crisis as fighting that continues across the country has displaced millions of people. Sudan descended into civil war on April 15, 2023 after a bitter power struggle between the Army Chief General Abdel Fattah al-Burhan and Hemedti. Their forces had operated alongside one another before they turned their weapons on each other. The dispute centered partly on how and when the RSF will be integrated into the regular army as Sudan tried to transition back to civilian rule. Fighting erupted in the capital, Khartoum, and quickly spread across the country with RSF fighters seizing much of the capital while the army retained key military positions and relied on its advantage in the air. The true number of Ebola cases in the Democratic Republic of the Congo is likely at least double the official tally, according to a World Health Organization official. The WHO has confirmed at least 1,963 cases and at least 719 have died. Speaking after visiting the region, Chikwe Ihekwezu, the executive director of the WHO's Health Emergencies Program, said most deaths occurred in the family environment and not in medical centers. We think, with some of our support and modeling, the scale of the outbreak is at least 2 to 4 times the number of cases we are finding, Ihekwezu told reporters in Geneva on Tuesday. As of July 12, 727 patients were being treated in Ebola treatment centers across the areas affected by the epidemic, which experts say is the fastest growing Ebola outbreak ever recorded on the continent. Healthcare workers threatened to strike efforts to contain the outbreak face growing challenges as doctors and health workers in the affected areas in the DRC threatened to go on strike over the non-payment of their salaries. At the Ebola treatment center in Rampara, one of the hardest hit areas, healthcare workers burned a tire in protest on Monday and temporarily blocked access routes, the AFP news agency reported. The facility is located in Ituri province, the epicenter of the Ebola outbreak, where at least 384 cases have been confirmed, including 89 deaths. The DRC's National Institute of Public Health said healthcare workers accounted for a significant number of Ebola cases, including 112 transmissions and 35 deaths by Sunday. Across Africa, while poliovirus has been eliminated and Kenya has not recorded a case since 2013, however, a vaccine-derived strain can still circulate where too few children are immunized, allowing the weakened virus used in the oral polio vaccine to spread and mutate. It poses a risk only in under-immunized communities, particularly in remote and nomadic parts of the country. To stop its spreading, Kenya relies on 2 complementary surveillance systems. In Nairobi, health officials routinely test wastewater for traces of poliovirus, often detecting it before anyone develops symptoms. The information gathered by community health volunteers in high-risk communities such as Turkana and Samburu allows the ministry to respond quickly with targeted interventions. Dr. Gam Gello, the Ministry of Health national point person for polio surveillance, told Al Jazeera. Yet wastewater surveillance has its limits. It only works where sewer networks exist. In Kenya's sparsely populated north, where there are no wastewater sampling sites, the search depends on community health volunteers. Instead of waiting for sick children to reach health facilities, volunteers investigate reports of acute flaccid paralysis (AFP) and collect stool samples to determine whether poliovirus is circulating in communities that formal health services rarely reach. Senegalese President Bassirou Diomaye Faye has appointed veteran magistrate Ousmane Diagne as the new president of the Constitutional Council, following the death of Mamadou Badio Camara. The appointment comes at a time when the court is under increased public scrutiny after issuing a landmark ruling on constitutional reform. According to a presidential decree signed on July 13, 2026, President Faye officially named Ousmane Diagne to lead Senegal's Constitutional Council. Diagne had already been serving as a member of the country's highest constitutional court. He now succeeds the late Mamadou Badio Camara and will head the institution responsible for reviewing the constitutionality of laws, resolving electoral disputes, and ensuring that national elections are conducted fairly and legally. Ousmane Diagne brings many years of experience in Senegal's judicial system. During his distinguished career, he served as a Prosecutor General at the Dakar Court of Appeal, First Advocate General at the Supreme Court, and later as Minister of Justice before joining the Constitutional Council. According to the Observatory, President Faye selected Diagne from a short list of highly qualified candidates that include former Supreme Court presidents, a prosecutor general, and another serving member of the Constitutional Council. That's all we have time for on this edition of News Around Africa, and I'm Esther Wilson.